Hello, my name is Darren Polymus. Who am I speaking with today?
Good afternoon, Mr. Palamas. My name is Aurora Sarmiento, and I am an advanced practice nurse at PAH Downey Hospital and a passionate advocate for public health equity. In my time at PAH, I have shown my devotion to my job as a nurse by advocating for each and every patient, especially for those procedures that need intensive education. For example, open heart surgery. I recall a time when a patient had been informed of the need of an open heart surgery, and he did not understand the details of the surgery. I had to call the surgeon to come back because the patient had more questions. In another instance, I had a patient that had orders to be discharged, but started having chest pain. I called the doctor and informed him of the changes in the status of the patient. Although the doctor did not want to validate the pain, I had to follow the chain of command. The doctor ordered troponins and an echocardiogram, which did show the patient had mitral infarct. The patient had to have an angiogram procedure. These are just some of the things I have seen and done while at PAH, and I look forward to continuing my work there. I take advocating for my patients very seriously.
That is a very interesting line of work. Nurses are the backbone of the healthcare system. So how may I help you today?
I am here to respectfully propose a reform in our community's water fluoridation policy, one that upholds both scientific integrity and ethical principles outlined by the Robert Wood Johnson Foundation. While water fluoridation was originally implemented to reduce dental disease, emergent evidence has raised serious concerns about its safety, particularly in disadvantaged populations.
Is that so? Well, what concerns do you have and what type of evidence has been found?
Long-term exposure to fluoride has been linked to developmental neurotoxicity, thyroid dysfunction, and skeletal fluorosis. Stephen Peckman and Angie Awafeso in their study found that in regions where workers were exposed to fluoridated water in concentrations over 2 ppm, skeletal fluorosis was common. Other studies done by Ashley Maylene and Christine Till suggest increased risks of lower IQ and ADHD symptoms in children exposed to fluoride during pregnancy and early childhood. They came to these conclusions after doing a multivariate regression analysis on data collected from the CDC and the National Survey of Children's Health. These are not small risks, and they disproportionately affect vulnerable communities with outdated infrastructure and limited access to care. These findings have prompted not just academic concerns but legal action. A recent federal court ruling required the Environmental Protection Agency to reevaluate the safety of water fluoridation following credible evidence of harm. This ruling reinforced the growing need for local and national policy reassessment. Our policy in La Puente and LA County has remained largely unchanged despite this growing evidence. Yet many people don't know that fluoride is in their water or that long-term exposure could pose health consequences. This violates both autonomy and transparency. According to the Bellman Report, for a person means individuals have the right to be fully informed about any potential risks. The Robert Wood Johnson Foundation reminds us that everyone deserves the opportunity to live the healthiest life possible. That means public health policy like water fluoridation must align with ethical principles, autonomy, beneficence, and justice.
Well, this is very disconcerting news. What changes would you like to propose?
I respectfully ask for your leadership in initiating a formal policy review of water fluoridation practice in our region. I propose 4 clear steps. 1. Launch public education campaigns based on current scientific evidence. 2nd, create community forums to promote public input. 3rd, reassess fluoride levels, especially in high-risk areas. 4th, invest in individualized alternative oral health programs. Together, we can realign our fluoridation policy with ethical standards while ensuring that our public health practices are not only evidence-based, but also community-led, transparent, and just.
Well, thank you for the ample amount of information. I will take this into consideration upon review of the water fluoridation policy.
Thank you for your time and your ongoing commitment to health equity.
Thank you.